welcome the onset of spring for more than 50 million Americans who suffer from allergies and 25 million who live with asthma. It's a concerning time that triggers serious and potential life-threatening health conditions. Dr. Jamie Rutland is joining us with the best ways to protect your respiratory health while saving money. Good to have you on the show with us today, Doctor.
Hey, thanks for having me.
Yes, sir. Let's start off with how many Americans are affected by allergies and asthma annually, and when?
You know, if you look at how many Americans are affected by allergies, about 50 million Americans, which turns out to be about 1 in 4 in terms of seasonal allergies. When you look at asthma, and asthma is a specific type of allergy. It's allergic inflammation of the pipes carrying air to the lung. What happens there is you've got 25 to 30 million Americans that are affected by asthma. And when you look overall about when the peak season of allergies and asthma actually is, probably during the springtime when you've got lots of pollen in the air, you've got different danders around, the dogs are out, going outside, bringing the antigen back in the house, and that's what's going to stimulate your airways and stimulate that eye to have those type of inflammatory response type of symptoms.
Yeah, we're starting to get all that green stuff all over our cars now. That's for sure. Can you talk about the differences between allergies and asthma and their common triggers?
Yeah. So when you look at allergies, right, what we're talking about are people that are having symptoms of upper airway, so sinus symptoms, nasal congestion, right, sometimes mucus production, and eye type of symptoms, itchy, watery, runny eyes, right? That's really allergies. And what it is it's an overactive inflammatory response. You've got cells that line your eye, you've got cells that line your sinuses. As those cells are lining your eye and lining your sinuses, they're in constant contact with the environment, right? That is everything that floats around in the air, all kinds of molecules, sometimes wildfire smoke, respiratory viruses, tree antigen, grass antigen, dog dander, cat dander, pollens, all of these things floating around, they're in constant contact with these epithelial cells. These epithelial cells are going to over-respond to some things if you have that genetic predisposition to do so. And when they do, they actually recruit over your immune system, your white blood cells, and then these white blood cells are activated and release other molecules that lead to the symptoms, like histamine. That is what allergies are. And asthma, that same process is taking place. It's just taking place in the pipe that's carrying air to your lung. You got a pipe here, your trachea, this pipe breaks down into smaller little pipes that we call bronchi and then bronchioles, which are surrounded by muscle. When you have inflammation in those bronchioles, that muscle starts tripping. It gets aggravated. And when it gets aggravated, it contracts, and that leads to wheezing and coughing and shortness of breath.
Now, with all that being said, the next question I'm sure everybody wants to know, what can people do to help protect against allergies and asthma this spring? What can they do?
So physically, what can you do? So I think we have to think about avoiding the environment if those pollen levels are high, and if you can. Not really, really easy to do. That's one. Two, if you do have to be outside, like most of us do and want to be, when you come inside and you're set at home, take a shower, wash your hair, get that antigen and all that stuff out and off of your body. Because when you do that, you can breathe in easier. And then also, if you can afford it, get an air purifier, which also keeps the environment that surrounds you pretty clear of those antigens to help you breathe easier so you don't stimulate that inflammatory response. And from a prescription perspective, take an antihistamine, take a nasal decongestant, take an intranasal steroid, take your inhalers, and allow that inflammatory response to be calm so that you'll be calm when you're in your environment.
I like that, not only taking a shower, but washing your hair, because all of that stuff is in your hair, and you go to sleep, you're just breathing it all night long, right?
100%. When that stuff is in your hair, not only is it in your hair, right, but then it gets on your pillow because you're laying on your pillow. And as you lay on your pillow and you're tossing and turning, you're just putting your nose in that pillow and inhaling those antigens, and that can really aggravate that inflammatory response.
Yes, sir. Medications are a big expense. How can people save money on them? Could you go with generics?
Yeah, you can go with generics, and one of the best places to go with generics is at BuzzRx, which is a free prescription discount card and app service allowing you to instantly save money on your medications. The way we use it in our practice is we'll take patients to the BuzzRx app or take patients to the BuzzRx webpage, BuzzRx.com. We'll type in the medication in the search bar, and when we type in that generic medication in the search bar, let's look at albuterol, for instance. When you type in albuterol, the average cost of albuterol in this country is about $110. We give it a lot in asthmatics. And so when you type it into BuzzRx, you're going to save up to 80%. You'll get that cost all the way down to about $20 with savings from BuzzRx.com. And so that's the way we use it in our practice, because patients save up to 80% of the costs on medication. And it doesn't matter if you have insurance or not, you're still able to use that discount card.
So going to BuzzRx is pretty much the answer to help a lot of people with the allergies and also getting prescriptions at a really good discount.
Oh, for sure. That's definitely the right thing to do. BuzzRx can definitely help you out with a lot of prescriptions, get them at a discount. I do want to mention this. The asthma strategy for management has changed recently. So we don't just give albuterol anymore. We also give an inhaled corticosteroid, and one of the names of them is called fluticasone. And so when you go to fluticasone, for instance, it's about $90 on average. When you use the BuzzRx discount card for fluticasone, you're also going to save about $62, $64, and you'll get that prescription for about $28 as well. So you're going to save significant amount of money when you go to BuzzRx.com and you're treating your asthma with both albuterol, which is a beta agonist, and fluticasone, an inhaled corticosteroid, which you should take every time you take your albuterol.
Fantastic. A man who's coming in from one of the most beautiful places in the country, Southern California, where they always have great weather. Thank you so much for joining us today, Doctor.
Thanks for having me.
And we have more Low Country Live right after this, so stay with us.